My name's Louise. I live in Gibraltar and I work in one of the clinics that Dr. Thomas Boerger practices out of. I initially met Thomas a year ago, February gone, after having a fall and feeling that I had something wrong with my hip. At the time, I already was suffering from pain in my knee, and it was something that we discussed. However, I was treated for when I'd had the fall and consequently came to see Thomas a few months later to discuss what was the pain that was going on in my knee. So on seeing Thomas regarding my knee, we did have a long discussion about how young I am and how active I am. I have for a lot of years been very active, a fitness instructor, an avid hill runner, a swimmer. So to me, having pain in my knee was a restriction, and not only did it affect my physical activity, it also affected my mental health because I was used to being so active. Moving forward, we had an x-ray on my knee and it was brought to light that I would fall into the category to have a knee replacement. This was something I would have to think about considering my age. However, for me to have a knee that I'm able to use rather than a knee that I can't use meant so much more to me. So we decided to go ahead and have the partial knee replacement. So when we initially discussed again, Dr. Boerger took his really time and interest in the knee replacement that I'd had previously. He then told me the options that I could have for the knee replacement, and he went out of his way to get the exact same knee replacement in the left knee that I'd have in the right knee, which to me was really good because I was thinking, oh, I'm going to have the same knees. So that also made me feel at ease. Going into the surgery, he explained how precise, how much better it is now that we can do it by robotics because it's so precise. I mean, it does it to the minuscule of a millimetre, where it's going to go, how it's going to fit. I have always been fit and active, and I think that has played a big part in my life. So to be restricted and not be able to do that was soul destroying. However, I was a bit apprehensive about the recovery because obviously I've had a knee replacement done before, but this time it was like night and day. The surgery went so well. I was awake straight away. I was moving my knee straight away, which I never expected. I was so determined to be back on my feet, to be fit with a positive mental attitude towards my recovery. And I think that played a huge part within my recovery. I was off my medication after 5 days. And I was off my crutches after a week and a half, 2 weeks. And I just kept working, kept doing as I was told, kept doing what Thomas had told me to do. Dr. Boerger was very much pushing me to walk and walk and walk. And I tried, and I would go out and walk. Anytime I could actually get out the house, I would go out and walk. And I think anybody going into having a knee replacement, it's the thought of the after. It's how many horror stories people have told you about a knee replacement. It's not the case. I've had 2 done and I've recovered, and I'm back swimming, I'm back rowing, I'm back doing 20,000 steps a day and walking my dog. So I couldn't be happier.